All right, folks, what the fuck is going on with this coronavirus thing? The coronavirus, aka COVID-19. Here in the US, especially, it's a country of extremes. You have, far left or far right. You have red or blue. There seems to be like a polarizing dynamic to most conversations, whether it's politics. And I think it's more prevalent now because of politics and because we're in a presidential election year. And the last few divisive years that we've had under President Trump, I'm sure have exacerbated this type of mentality and this just the energy that's in the zeitgeist here in the U.S. But this conversation with COVID-19 was no different. You have people thinking and saying that it's a hoax, it's not that serious. Every couple of years there's something new like Zika or the bird flu or Ebola. And then you have folks touting the exact opposite, that this is like the zombie apocalypse, Walking Dead type shit is about to start happening and it's the end of the world. And if you guys are anything like me, that kind of leaves us like, what the fuck, right? I mean, my knee-jerk reaction is to assume that the truth is somewhere, like in the middle, like a balance of those two extremes. But I don't want to be too far off in either direction, right? I don't want to be the guy hoarding water and toilet paper and canned goods, a year's worth of that stuff, nor do I want to be the aloof guy walking down the street, carrying the disease, infecting everyone around me, and then getting eaten by zombies or some shit, right? So one of the first things I did was see if Rogan had any folks on to speak about the topic, because the thing about Rogan's podcast is that usually when there's something prevalent like this going on, and just in general, the folks that he has on are like the cream of the crop, top tier folks within their field, right? Like he'll have Navy SEALs on, presidential candidates, best comics in the world, best UFC fighters in the world, MMA fighters rather, best boxers in the world, scientists, neuroscientists, astrophysicists, nutrition experts, you name it. So I checked, and he actually did have a gentleman by the name of Michael Osterholm on, which is an infectious disease and epidemiology expert who also wrote Deadliest Enemy, Our War Against Deadly Germs. Now, that podcast helped put a lot of things in perspective for me, as well as put me on to go-to resources like the CDC and like Johns Hopkins website to go to. But most importantly, he definitely helped reconcile those two extremes that I was already accustomed to hearing on, social media, as well as on the regular news on TV. So a couple main takeaways that I took from the conversation is that Michael Osterholm says that this is just the beginning and it's going to last several months. So folks should definitely stop acting like it's a storm and start realizing that it's more like a winter. It's not something that, it's going to end civilization, but it is something that's going to get worse before it starts getting better, and it's going to last several months. Now, mind you, I listened to this conversation, came out over about a week ago. Today's March 17th as I'm recording this. This episode posted on March 10th. And since then, everything he's mentioned, several of the things he mentioned have been coming to fruition. He also published a paper or something about this in early February. So over a month and a half ago, stating just how serious this most likely will become and how fast this would spread. So while most folks were writing it off, including myself in the beginning, more people die of the flu of this every year, we weren't factoring in certain things like the fact that this disease has something called an R naught, which is the fact that it's doubling every time in terms of occurrences. And we can see this with the number of occurrences that keep coming out day after day after day of people testing positive as well as people dying. So at first, when, there's a couple hundred people, a percentage of that is not much in terms of mortality rate. But as that couple hundred people becomes 400 people, then becomes 800 people because of this R-naughting doubling effect, then becomes 1,600 and, just exponentially gets bigger, bigger, and bigger, that percentage, the mortality rate percentage, translates into a much higher number. And the reason why this shit is spreading like wildfire is because it's so easy to transmit. Anyone can be carrying it without even knowing it, without showing symptoms, and giving it to other folks. And then they continue the cycle of giving it to others and transmitting it, etc. Typical symptoms are similar to flu-like symptoms if you do have it, such as coughing and fever, shortness of breath. But again, symptoms are not had by everyone. Most likely, if you're in your 20s, 30s, 40s, 50s, you won't have or show symptoms. But folks that are more likely to show symptoms and that are most likely to die as a result of this virus are the elderly, are seniors. So the 60 to 69 range, 70 to 79 range, 80 to 89 range. Each of those age groups has a higher and higher percentage of all the deaths that have occurred have come from those age brackets, with a few very small percentage in the younger age groups. And if you have any type of autoimmune disease, you're at higher risk, such as MS or anything that would weaken your immune system. If you are obese, you're at higher risk. The United States has a very large obesity rate. If you have things like high blood pressure, which I have, you're at higher risk. If you're a smoker, and of course, again, if you are elderly. There's like a running tracker on a website called worldmeters.info/coronavirus. If you guys want to check this out, I bumped it up against the CDC and the Johns Hopkins numbers. They're right around the same range. Johns Hopkins is on average for each country. It gives you like a breakdown by country, showing slightly higher numbers than CDC. It could be a timing thing, as well as a reporting thing. But the numbers are all within the same range. So currently, according to worldmeters.info/coronavirus, there are 198,241 cases. Of these, there are 7,965 deaths already, and 81,743 folks that have actually recovered. And by recovered, meaning that they were sick, they were in the hospital, and they've been discharged. But from those closed cases of either discharged or deaths, the 7,965, that's a 9% mortality rate. Extremely high. And that's not counting the current folks that are showing mild conditions, which hopefully do not progress to worse. That's 101,000 folks. Very serious or critical condition, which is 6% of the active cases, are 7,020 folks, which hopefully will take a turn for the better. But this shit got real really quickly. And something that, again, staying with Michael Osterholm, that he stated is that this is going to wind up being 10 to 15 times worse than any flu. Based on current data, what they can project out is that there will be 96 million cases of folks with the coronavirus, about 480,000 deaths. And this would happen over the span of 3 to 7 months. So this is that winter that he's referenced. Now, I'm not saying to take everything this guy says as gospel. I hope he's wrong, but he hasn't been thus far. As things get worse and worse, those figures are becoming more and more prescient. And I would rather have an overcorrection from our public officials and our government than a lackluster response, which is what we started getting, and what Italy did, for example, in being behind the eight ball and not quarantining folks, not shutting down the country soon enough. They started by shutting down one town where they felt they had a cluster of cases. The virus just continued spreading to the point that now the entire country is quarantined and in lockdown, but they have far more patients than they have spaces in hospitals and equipment to deal with the sick patients. And they're literally choosing who lives and dies because they don't have enough equipment and hospital beds for as many cases as they have. And that is such a sad, unfortunate reality that I hope other public officials and governments heed and take as an immediate lesson of what not to do. Now, our government here in the U.S. definitely dragged its feet at the federal level. Trump and his administration early on stating that this was contained, stating that this is not really an American problem. There's such a low occurrence rate here. I think there were like 12 to 15 cases, confirmed cases at the time. According to Trump, he said, quote, the occurrences, the cases are going down within a couple days. So that's going to be a beautiful thing. Or as the weather warms up, the virus is going to die, etc. And a bunch of other dumb Trumpisms that he says and the yes men and women around him allow him to say. But thankfully, that type of bullshit was reconciled with the fact of exponentially growing cases here in the U.S. and the federal government finally declared a national emergency. Now, this was important in that it allowed for emergency funding, somewhere around like $50 billion to be released, as well as the speeding up of FDA approvals for tests and testing abilities. It allowed for the updating of archaic laws and systems that were in place that clearly could not deal with this type of pandemic. And hopefully a more robust system is put in place. And it's not just a pointing of the finger of an existing like legacy bad system. So those things are positives. So the ball is moving at least a bit in that sense. There was this like big press conference where he joined like the CEOs and or representatives of big companies like CVS and Walmart and Target, and they are all in agreement to offer their parking lots in certain areas for drive-through testing, which should have been a thing a long time ago. We should have gotten that from South Korea, which saw a lot of success with drive-through testing, where people would drive up to these locations, they would get a mouth swab, they would collect their contact information, and they would drive off and leave, and then get their test results in within 48 hours or so. And it's important to be able to test folks, right, that are feeling symptoms, because you want to know where the clusters are happening, where the sick people are, because that will inform where the virus could potentially be spreading and allow folks to act in terms of self-quarantining and or being, placed on the quarantine if necessary, so that we can contain the virus and hopefully kill it off by minimizing how it spreads and then having folks recover from it. Now, I live in New York City, in Queens, right? And I work downtown in Manhattan, New York City. And it's the biggest city in the world. Public transportation, millions of people take it every day. And it's spreading here, or there being cases here, has such an exponential growth ability that it's scary. So I'm happy that Governor Cuomo stepped up while the federal government was dragging its feet and started creating these partnerships with local labs to facilitate testing. The governor, as well as the mayor, Bill de Blasio, have been having press conferences and sharing information with people. There's one today actually by Mayor de Blasio stating that we might have to start a shelter-in-place system here in New York, which means, everybody staying home and being quarantined at home. He said this could happen as soon as the next 48 hours. And this would mean that nobody can leave their house unless it's for food and or medicine. De Blasio and Cuomo are always, or historically, often at odds. And although they're on the same side of this, coronavirus debate and, being overly careful, Cuomo did state that, we're not at that level yet in terms of having to implement a shelter in place. So they seem to be a bit at odds there. But there are places like Hoboken, New Jersey, which have implemented this. San Francisco in California has implemented this, as well as several other counties within California. And that's crazy shit, man. Parades, like today is St. Patrick's Day. Parades were canceled. The NBA closed down. All these like sporting leagues are closed down. The UFC had fights without people in the stands. Soccer stadiums are empty, and they're still playing games, but they're completely empty in terms of fans. It's like a eerie, weird, unprecedented thing that's going on. Businesses like restaurants and bars are pickup only. Some of them can't sustain that type of business, you know, being a pickup only. And some are closing indefinitely, so people are losing their jobs. Public schools here in New York have been officially closed for a minimum of a month. There's a lot of kids that, you know, they get their meals at school. And some are even, you know, like underprivileged kids where this is where they get their only meals. And schools are closed, but luckily they are having pickup meals set up so folks can go pick up the meals and return back home if necessary. And they are going to implement a remote teaching. A lot of businesses are also doing work from home, including mine, thankfully, even though some were flirting with the idea of, you know, half the staff working in office and half the staff working from home. 1 week yes, 1 week no, type of thing. But that has switched to like complete work from home across the board in a lot of businesses, which that's the long-term safer play, right? In terms of, you know, everything we were just speaking about, in terms of the potential spread of the disease. And also, I would imagine, you know, corporations would want a healthy workforce versus a dead one. But sometimes that's just not clear with the way that some decisions are made. And, you know, optimizing that bottom line, you know, day in and day out. Sometimes, unfortunately, a short-term view trumps long-term outlook. But I don't know, man. Fucking the Fed cut interest rates to near zero. The stock market is tanking. The earliest projections that I've heard or read about for an actual vaccine for this, by the way, is a year plus out. Meaning it could take until 2021 for there to be an actual vaccine for this. And that's not to say that the disease won't be somewhat under control or contained by then, because it very well can be. But in terms of like assurance, here's a vaccine, boom, you don't have it anymore, or you can't get it anymore, like kind of like a flu shot type shit, that's at least a year out. So until then, I would definitely implore you to follow the typical protocol that is being spread everywhere, which is wash your hands for 20 seconds at a time. Wash your hands very often. Avoid touching your face. Avoid practice social distancing, meaning avoid being in close contact with too many folks that you don't need to be in contact with. They say you should maintain like 6 feet away from people if you absolutely do have to be out in the street or whatever. The White House put out a coronavirus guidelines for America PDF that I'll link to in the episode notes. It's called 15 Days to Slow the Spread. And they have the following bullet points on there, which are: listen to and follow the directions of your state and local authorities. If you feel sick, stay home. Do not go to work. Contact your medical provider, which is another thing, right? A lot of folks don't have like sick days or the ability to work from home, paid family leave, like stuff like that. And it's terrible for those people because from a business perspective, are you going to pay them? They're technically not producing and doing work. And where's the business getting the money to pay them if their business is pretty much slowed down to a halt? And then from a human perspective, as an employee, you know, this is out of their control, but they also need to feed their families and pay bills, etc. There's like several different bills and items, I believe, on the Senate floor and on the House floor related to this, and even passing a bill for emergency funding and assistance for small businesses, as well as for people directly, like Andrew Yang's universal basic income idea. I've heard floated around as a potential aid in this case, which, if you guys aren't familiar with UBI, it's pretty much every American over the age of 18 would get $1,000 a month from the government, just cut directly to them. So this is just getting like more and more serious. All right, the next bullet point on this White House alert PDF thing is: if your children are sick, keep them at home. Do not send them to school. Contact your medical provider. If someone in your household has tested positive for the coronavirus, keep the entire household at home. Do not go to work. Do not go to school. Contact your medical provider. If you are an older person, stay home and away from other people. And if you are a person with a serious underlying health condition, that can put you at increased risk. For example, a condition that impairs your lung or heart function or weakens your immune system. Stay home and away from other people. Avoid discretionary travel, shopping, social visits, etc. Practice good hygiene, like washing your hands, avoid touching your face, sneeze or cough into a tissue or inside of your elbow. Disinfect frequently. And I will link to that in the episode notes. Also, I will link to that I like more, I want to say, than the CDC website, because there's been, delays in providing data, and it's also, tied to an administration that wasn't like properly funding it. And although it is a great, go-to resource, most folks do point to it. I also like to track and check Johns Hopkins Center for Health and Security, which I was put onto again by that conversation with Michael Osterholm. And what I like mainly from them, from their resources COVID page, is that they put out a PDF and you can sign up for it. They'll send it directly to your email as well on a daily basis with all the updates from the counts of occurrences, the counts of deaths in each individual country broken down, different precautionary measures that countries are putting in place, bills that are being spoken of in Congress, for example, et cetera, et cetera, et cetera. It's like a one-stop shop of everything you need to know, and it's like on a 1 to 2 page PDF on a daily basis. I will link to that in the episode notes. That's pretty much it. That's all I got on the coronavirus, folks. Stay safe. Wash those dirty hands.